hold, which you've always done. And what I do before I start, I'll make sure, and look at the way I'm standing. I'm not standing with my feet closed in. I'm not standing with one foot there, one on there, okay? I'm also aware that if there's any oil on the floor, I am liable if I go slipping and I hurt. So check that your plinth is open fully. It's amazing how many times with these cables, when you're applying pressure, that the cable can close. And if the client goes falling flat, they are issues. Okay, so just make sure your plinth is stable. Right, so what I'm doing, I'm holding the client. As you can see, I'm very new at this, quite nervous, okay? And that's how I hold, right? No? Okay. Solid, firm, because this is the first time your client will actually get a feel of your hand. Okay? What I often do is just ask the client to take a deep breath in. Slowly out. So I can just sense how my client's feeling. What is the next important step in massage? Do I take the towel down off here? And do your mat, right? Okay. What I often do is I start at the leg end, bring it down in one motion, tuck it in, okay, and straighten the towel. Keeping it neat. There are ways which I've seen before, you can actually take it down in one move, but I think you actually teach the one. Yeah. Right. Now, before I place my hands on the client, I should make sure that everything I need is close to them by. Someone said to you one day, and treat a client, you leave the oil between the client's legs. I wouldn't initially. Okay, I'd make sure that I'm in full sight of that stuff. Picking up the oil. What I would do, just to start with just a quick visual check on the client, if I noticed a mole that's raised, look at that, take into account that this would have all been done. Maybe you, when you observed or assessed your client originally, you may not have asked them to take off any clothing, okay? Or you may have asked them to stand up and let me look, did you? But here you can actually mark off, and I think it was you with your codes, great idea. We actually use color codes, and we have a body chart. Half of it is what the client says they have, tightness, blah, blah, blah. Other half of the body, so imagine the body split into two, is what you find. Okay, so they may think they've got tiredness, but when you go to the other side and start feeling around that, they realize that maybe it's common. Okay. So observe, use codes and colors. You may want red for muscles, yellow for nerves, or whatever the case is. So you're marking off on your chart. I'm looking to just see the body's aligned. With a female with long hair, before I ask her to lie down, I would probably ask her to tie the hair back. Okay? If I notice the neck wrinkling in, what I may do is roll up another towel, keep it flat underneath the shoulders, just to keep it balanced. Okay? So again, just avoid putting any pressure on the neck. Okay? So if you want to, I often use a rolled up towel just to balance across the back. Okay? Make sure my hands are warm. Have any of you had cold hands above your back? What do you do? So all I do is the hold again, so that the client has got a good feel of my pressure. My hands, is that warm enough for you? And what I just do is get a quick feel of my client's skin. If it's oily, okay, if it's dry, that gives me a little indication of how much oil I want to apply. I'll pour the oil into my hand first, warm up the oil in my hand, and apply it using the first stroke that you have learned, which is called? And what does it do?
Spreads the oil.
Okay. Is it a deep stroke?
No.
Can it be deep?
Yeah.
How would you make it into a deeper stroke? Okay, good. Right, I'm going to show you the way that I do it, okay? I like to start at the head because I like all my strokes to return to the heart, okay? I start right at the base of the skull, right up there. Remember, it's with the palm, so I lean forward, ask the client to breathe in. Slowly out. Fingers apart, pull back, release pressure over bones, down the arms, and into the neck, ending with a stretch. Okay? You can start the stroke over here and move up and around. So there's many ways in which you can actually do the first of a stroke. But the idea here is that each time I render the stroke, I increase the pressure. And the way that I do it is a push and a pull. Okay? So if I want to go deeper now, it doesn't mean I have to push harder. What I do, I transfer my weight. Okay? And then change my leg position as I pull back. Would that feel deep, deeper for you? Okay, now again, very deep. Okay, if I want to. But look at the issue here. I'm not on my client's head. Can you see that? So unless I breathe in and I hold it, so just be aware of that. So if that is an issue, I may do it like that. Okay, on the side. What have you learned next? The key thing about massage is what? Not the stroke you're applying, but
Good flow.
flow, good. The relationship between them strokes. I could then go into a one-handed stroke and then pick up. I usually do this down here into more of a, what's this called? Petrissage. Kneading. And my idea, everyone needs to be kneaded. Okay. Right. What are we actually working through on here? If I cut the skin away, what have I got next to lay? Fat, okay? What does fat have? Do you know? What runs through fat? Did any of you have grandparents who did this to you? You couldn't understand it, it was quite sore. Okay, you've got nerves. So if you pinch that, it's going to be sore for your client. So what you want to do, you want to get that effective motion. You want to actually see the skin move. And the way that I often do it, have any of you seen the film Karate Kid? Wax on and wax off, okay? So moving around, moving up, okay? Bringing it into the neck, okay? Rolling it around. So you want to get that motion going. If I wanted to move and work on this side, do I take my hands off? No, because I lose contact. So you can work around and make sure that you're maintaining the flow, okay? If I found spots here that are tight or deep, what do? What other strokes could I use?
Compression.
Compression. So what do we need to do before we can work deeply?
Warm up.
How do you warm up?
Can you say
Okay, so we can use some friction-based. The compression move, what I do, I keep it quite static, okay? You can use fingers, I use a little bit of elbow, knuckling. Friction is actually a motional stroke, okay? So what I often use is working down onto the muscle using the palm of my hand. I often use palm, you can use friction with fingertips. But what you want to do is make sure that there's an increase in blood flow. How do you know that there's an increase in blood flow? Okay, all you can do on that, push on down. If it leaves a white spot, it's deprived, it may be deprived. Or if you know that blood rushes in and immediately fills up, that's fine. And what I actually do is try and locate these tight spots, and I practice with my eyes closed. So I get a good feel of what I'm working on. I can feel fascia over here, I can feel the ribs. I know if I push on there, I'm on rib, I'm not on muscle. So you've got a range of strokes. What I want to focus on now is showing you the newer strokes. Are there any questions that any of you have with the revision of strokes? Okay, I integrate stretches as well, and I'll show you a magic trick at the end that I often use this for, just as a bonus if there's time.